I just have a question. Do the panel have any thoughts on the use of lanreotide to prevent tumour recurrence rather than control of active disease?
I have a comment on that. There's that's called adjuvant therapy. So after you've had surgery, for example, if you've got a lot of disease, and let's say you've got surgery for the liver that Justin might take out or Per Hellman might take out, we've got about this is not applied to you or your family member or whatever, but in general there's about a 30 to 50% chance over 5 to 6 years, depending on the amount of disease that you had, that you might get a recurrence. So the question is, can you give therapy to stop that happening? And that's called adjuvant therapy. The answer is we don't fully know. There's been some data looking back and trying to work out patients who had it. Does that stop it coming back? And it's a very mixed group. We call that heterogeneous group. So the data so far is not compelling on that. And there are 2 studies starting fairly soon looking at giving this lutetium therapy that we send patients to Sweden for, to Rotterdam, to see would that work, in fact, by giving 4 cycles of this lutetium therapy. Lanreotide is a very good option because it's far better tolerated and it's not as, it doesn't have the same amount of side effects. And it would perhaps work in a subset of patients. And there's a study about to start led by a girl called Andrea Frilling, who's a professor of surgery in London. And we were invited to take part and participate in this trial. So we're looking at the feasibility of doing that. So there are very, very good clinical research questions to ask. So it is possible that it actually will work. And there's another category of patients who also would like to address. Sometimes we have patients who have had a good response, let's say, to a chemotherapy or something active, and they haven't had their disease reduced to 0 level. Sometimes we start a somatostatin analog like lanreotide or octreotide to try to we've had a good response, to try to prevent it coming back or to growing again. And that's another strategy we sometimes use, and we're looking at answering that question in a research manner as well. So there's ongoing work to look at that.